From your perspective, what changes in the way that these health programs are financed?
One of the things which is coming up very clearly is, where are our governments? Because most of the times, when you hear there's a net distribution which is going to come, there will be a universal coverage which is going to come. There will be IRS in those spraying which is going. Most of it is donor, is really donor funded. Some of them are policy issues. If you look at the national budgets for most of our governments here in Africa, how much do we really put towards towards such kind of interventions if we were to have an outbreak? That's number one. The second thing is whenever the donor, the budgets are produced in Africa, most of the budgets I've seen of lately, most of them will say, part of this money will come from our cooperating partners. And if there's no buy-in, if there's no buy-in, then we have also challenges. The other thing, we also need, because also the donors, they also want to see accountability. I mean, one of the things which is really, killing Africa is the corruption, the corruption element, which, most of these donor-funded projects, it's really not going to the indigenous, just a portion of it goes to, and it ends up in big workshops, in expensive hotels, and, no one documents that, and those are some of the challenges. The other thing is the continuation of most of these programs. One program will come, after 5 years, that project closes up. Another, bid will be issued out either by DFID or USAID or, whichever, OSAID. They will put up all these bids, and then the next implementer who is going to come up is going to do, almost the same things which the other people actually did. It's more or less like they're starting afresh, like there was nothing completely which was done. So you go in most of our, in our governments, offices, you find good, huge, good documents which have been written by very educated, public health, practitioners. But then, the other donors, the implementing partners who will come, they'll come and start all over that, oh, we need to work on your strategic plan, we need to revise your, and then, the entire strategic plans of this government, they keep on changing, and no one really pays attention to it. So these are some of the suggestions. If we could make sure that we strengthen the other component, is we strengthen the systems. Then the final thing, I could also point out, I know, for example, like USAID has been thinking of, USAID Forward, where the donor funded, most of the the funding should go to indigenous African organizations. I buy that idea. I don't have any any challenge with those ideas, but then we need to be extremely cautious, because USAID rules, for example, even if you look at DFID rules, for example, they won't bend the rules. The rules, the regulation, the policies and the regulations will still be the same. Now the question is, these African organizations who are going to be entrusted with these millions of US dollars, have we really, brought them to the level to where they can be able to manage, this huge funding which is going to come into their, into their coffers? Have we strengthened their system so that they can be able to manage these USAID rules and regulations which are in place? Because those ones will never change. They'll always be in, they'll always be in place. There's a lot of partnering which is happening on the, on the ground with the indigenous African organizations, but then, one of the challenges, Michael, is that some of these, what we call, local NGOs, they are actually, the term I usually use as personal-centered. You know, they are made. They are not run as an organization. You know, and you know, they are not run as an organization, but they are run as if it's an individual NGO. You know, because that individual then makes most of the final decisions. So there's no separation between the NGO and the founders of the, you know, of this NGO. So there's that separation. You don't really see it. So those are some of the challenges which we still need to work with, you know, local organizations if they really want to come to the level where implementing partners like those, you know, from the, you know, from the development, you know, from the developed world, you know, have reached. You know, if we can work on that, then yes, we are going to be able to, you know, but as long as they are still centered on, you know, individuals, you know, it's still going to be a challenge.